Welcome everyone to the Central Coast Home Health and Hospice presentation. Today we have Karen Empey, who is the HR liaison for the company and also has a background as a PT. She'll be sharing today about the company and the wonderful aspects of working for Central Coast. So Karen, I'm going to stop sharing here.
Okay.
And please just go ahead and take it away.
Okay, let me share my screen here. Well, welcome everybody. As you know, my name is Karen Empey, and I am a PT who has been working with Central Coast Home Health for about 8 years. I started as a PT in the company. I then, after a couple of years, they asked me to move into the director of rehab, so I was in charge of all the therapy side of things. And then just most recently, I've moved into another position of more of an HR liaison and trying to recruit therapists and nurses to come and work for our company. As you know, we're located here on the beautiful coast of California, about halfway between LA and San Francisco, and we cover all of San Luis Obispo and Santa Barbara counties. The company was started approximately, my slideshow's not going. Let's see. Well,
click on the left from beginning. There you go.
Oh, left from beginning. There we go. Okay, thank you.
Yeah.
So anyway, here we are in beautiful Santa Barbara, and we'll catch up here. This is Pismo Beach. So we're very lucky to call this amazing area home. The company was started about 12 years ago by 3 clinicians. So a PT assistant, and an OT. And they just felt that this area could use a better home health agency. They all worked together in a hospital, and they felt that they could supply the community with some better home health care. So they did everything from the ground up, from seeing patients to getting referrals to doing the billing and any of the coding. Needless to say, now we are 12 years later, and we have a staff of close to 350 to 400 employees, and we continue to grow very quickly throughout the Central Coast. We are one of the largest home health agencies in the nation, but what really sets us apart from other home health agencies is that we are clinically owned and not owned by a large corporation. So the owners are in the office every day. They understand what it's like to be out in the field seeing patients. They're available for questions, and they have all of our clinical staff is also therapists or nurses who have also worked out in the field. So we all know what it's like to see patients out in the home. And our staff is always available for any kind of needs. We have in-house nurses and LVNs that are available for our staff for any questions that they might have. So whether it's calling doctor's offices or assisting our staff with getting a hold of patients, or even getting a second opinion on what is the best care for that patient, our clinical supervisors are available throughout the day. The unique part of home health is that you're in the patient's home, you're seeing the patient in their own environment. And so that really sets us apart from any other setting. And it really allows a lot of flexibility as well for your scheduling, because you set up the day and the time that you're actually going to go and see the patient. And so, because we're in their home, we're able to better address their individual needs. You obviously get to learn about the patient, but also there are any family dynamics that might be occurring, and you can address the patient as a whole because we're in their home. Central Coast Home Health, a big part of the company is that they really respect and hope that the staff reaches out and asks questions, and they want to hear your ideas and suggestions. So over the last 12 years, we have really grown into some specialty programs as well. Some of our programs involve Parkinson's specialists, lymphedema specialists, and wound care specialists, and those are all physical therapists and nurses that have gone and gotten their specialty programs. And that all started from clinicians who just felt that those specialty programs or certifications was really something that would benefit our patients within the community. And so they presented those specialties to the owners who agreed. And now we have quite a large group of specialty programs. We also have recently, because of COVID, started some remote monitoring programs, which allows our staff to bring in an iPad-like device where the patient can enter all sorts of information, and that information is then sent to one of our nurses in the office, who will then review it and feel and see if the doctors need to know that information, and then they'll pass that on to the doctor. So it really helps kind of bridge that gap between the patient at home and the doctor's offices. We're kind of the go-between for the patients. And it also helps for those patients who can't get out to go see their doctors in their offices. It allows the doctors to actually have video chats with the patient or within the family as well. We have an excellent reputation throughout the Central Coast of San Luis Obispo and Santa Barbara. We are constantly growing. We are very involved in the community. We do a lot of community projects, from hosting Parkinson's expos to doing Alzheimer walks. So you name it, we are out there doing it. We are currently looking for full-time and part-time nurses and LVNs. The state does require for any nurse working in home health that they have at least 1 year of nursing experience. It does not need to be home health, but they do have to be have experience. So we're really looking for those LVNs that have decided to go back and get their RN degree. Then we can hire them as a new grad. But unfortunately, a new RN nurse is not. We can't hire you because of the state regulations. Let's see, we're currently have a $10,000 sign-on bonus for full-time nurses working in the Santa Barbara or Santa Maria areas. We offer all sorts of medical, dental, vision programs, paid personal and sick time off, holiday pay, gym memberships, 401k. Again, that flexible schedule, which is where you get to pick or you decide what days you're going to be seeing patients. So having family, children, it works really well. You still get to go see your kids' soccer games or any activities that they are doing at school, because you can schedule your day around those activities. Let's see. So again, we're looking for grads who have at least 1 year experience. We're growing fastest in our Santa Barbara territories. We have a lot of opportunities and openings throughout the Santa Barbara and San Luis Obispo counties. You have to have a California nursing license and also a valid driver's license to work in home health. We're also open to looking at assisting your loan payoffs or assisting in helping you with your tuition. Again, the beauty of this company is it's very family oriented. We do a lot of company events, from mountain bike riding to family river rafting trips. We put together softball teams. And it's a great way for us to reconnect with our fellow employees and our staff, because in home health, it is such an independent type of work. You're, you are by yourself in the patient's home. So we don't get to see all of the nurses and therapists on a daily basis. So we really try to pull everybody together with lots of company events. And the owners are real big believers in work hard, play hard, life balances. And so, come and check out Central Coast Home Health, see what we have to offer. We're open to all sorts of different ideas, and we hope to see you come and apply for a job with us. And that's what we have for today.
Thank you so much, Karen. That was great. I have one question before
Sure.
we end our session, and that is about the 1-year experience. Can you describe what that is? Does that mean after their boards, they would have had to have worked a full year somewhere else, or what's the deal?
Correct. So I know you guys have the LVN to RN program, and that's what we're really trying to target. Are those nurses that have some experience as an LVN and now are going back for their RN degree. Unfortunately, the state requires us for any nurse to be in the patient's home, they have to have 1 year of some kind of nursing experience. It can't be volunteer work. It can't be shadowing. You have to be either an LVN or an RN that has 1 year of any kind of nursing experience. Does not have to be home health. But yes, so if you have never worked as a nurse before, you're getting your degree, we would need you to work somewhere else for a year, and then you would be able to apply for a job with home health.
Thank you. Thanks for clarifying.
Sure.
Anything else you'd like to say before we sign off?
I don't think so. I'd love for, anybody has any questions. I know my information is being posted here. So, if you're not sure or you, are interested in observing, we do set up some ride-alongs where you can ride with a nurse for a day and kind of see what home health is actually like. It is a wonderful setting. So I highly encourage you all to consider looking at home health as a possible setting for your future career in nursing.
Thank you, Karen.
Thank you so much. It was nice to meet you.